Welcome back to the Senior Advocators. I'm Ginell Butler, a gerontologist who studies aging. Today I want to talk about something near and dear to my heart, and that is Black healthcare disparities as it relates to dementia and Alzheimer's. And I go into various facilities and interact with a number of people, whether they're in our community or doctors, physicians, psychiatrists, all as it relates to folks in my community, in our culture, who have a dementia or may have Alzheimer's. Remember, Alzheimer's is a dementia. There's Big Daddy D, and he had 10 children. The number one disease is Alzheimer's. With that said, Black folks face a lot of disparities, and a disparity is simply an inequality or an imbalance or noticeable difference between two or more things. And that said is many factors, at least 4 of them I'll talk about today, that are key. We're facing in this community, as it relates to dementia and Alzheimer's, things like underlying health conditions. There's some social determinants of health. There is chronic stress and discrimination. There's genetic factors. So, for example, there are higher rates of chronic diseases like blood pressure, diabetes, cardiovascular issues, cholesterol. None of those are the Black community's friends. But those specific factors lead us into the disease of dementia. Then we talk about other, if you will, other health factors. There's systemic inequities in the community. Therefore, for example, there may be some disadvantages in terms of education, in terms of access to hospitals, in terms of understanding the process it takes when one goes into a facility and tries to explain that their loved one has, say, a dementia and just can't relate. They can't navigate the system. They don't know how. So the disadvantages of education and just understanding these systems to get our loved ones to these hospitals and other areas is key, and it's killing us. Then there is also this whole notion of chronic stress and discrimination. Yes, there is systemic and interpersonal racism. I can't make this up, folks. It's just real. And that is impacting Black folks to have, if you will, a higher level of cognitive memory issues. Yes, the stats are showing that. It is true. Black people are more prone to having dementia or an Alzheimer, twice as likely, in fact, than that of older white Americans. The facts do not lie. Another key factor is genetic factors. There is a protein, and it's called APOE. In short, basically what that is, and that's going to be a homework assignment for you, is it is a fat combined with a protein that rolls up into Black folks' heads or into the brain. And primarily, it is being found that this is most common in Black Americans who end up with a dementia. So it could be a genetic factor. But until you get your loved one to a particular hospital or setting, then you're not going to know that this is really key. Which brings me to this whole discussion, of what are some of the actual burdens that we face. We face things in the Black community like caregiver strain. In other words, Black folks are going to take care of their loved ones. It has been culturally known over time. We will do that, but we will do it sometimes to a fault, if you will. By the time we finish taking care of our loved ones, if we're not so burnt out and have passed on ourselves, then sometimes we're late getting to the doctor's office, which leads us then into underdiagnosis of the disease. Our loved ones are so far gone that the diagnosis, because we think, oh, it's just a memory problem, oh, they're just forgetting. By the time we get our loved one to the doctor, it is so far gone that the disease has run rampant. So if there are 7 stages to Alzheimer's, Oftentimes we get our loved ones so late to the doctors to get the lab work, to get the blood work, to get all these proper things that are required for a proper diagnosis. And then our loved one is pretty much not only under diagnosis, but it's very, very late. And so the disease then is so severe and so far gone that it's just really difficult to get proper treatment. Not that it can't be done, but we're late to the party, if you will. And then the other thing is we have a cultural stigma. We are not always likely to go to the doctor. We don't know what's going to happen. No, I don't think I need to get there. No, the person will be fine. And then that's a misconception. The severity of this disease is real. And so when we hang on to our, if you will, hanks and are scared, and I understand that, then we do a disservice to ourselves and to our community, because the disease, and that's what it is, it's a disease. It's not just a memory loss. There is a disease that is running rampant. And so we need to be able to define the difference between, yes, Alzheimer's and our dementia are progressive cognitive memory loss diseases versus I'm just having a normal aging issue and I'm just forgetting. No, it's a disease, and you will be expiring when we don't get the proper help and need. And then the last thing that might be a burden may be that we don't do clinical trials, folks. We just don't do it. I ain't going. I don't need no clinical trial. They're going to give me, I don't know what they're going to give me. We end up going back to the past. We do ourselves a disservice. I am hoping that this just gives you a snippet of the disparities, but let's not burden ourselves such that we can't be open-minded enough to possibly try a clinical trial. We have nothing to lose at this point. We are leaving this planet by virtue of this disease in huge numbers. By 2030, they're saying almost 8.1 million people or more will have the disease, and a good portion of them will be Black folk. So I'm hoping that you're open enough. If you need help, just trying to navigate these systems and these processes, call and reach out to the Senior Advocator. I want to thank you so much for listening to this episode, and I look forward to seeing you on the next. Thank you for sharing this time with me. If what you have heard and what we talked about has been helpful, please scroll down and check the description where I have placed resources and links for you. And if you want more than a podcast episode, go to SeniorAdvocators.org. That's SeniorAdvocators.org, where you will find free resources for you. And if you want to talk over your specific situation, I'm there too. Now, before you go, please like, share, and subscribe. This will help many families who need to find this show when they most need it. Remember, you cannot go this alone. I'll see you in the next episode.